out there with type 1 diabetes. Today I'm going to answer the question of what actually causes a low. There's only one thing that causes a low blood sugar. So be sure to watch today's video all the way through to find out. Perhaps you're just finding me. If so, welcome. This is my 102nd Facebook Live that I've started since COVID world began back in the end of March. I was really just moved to want to help you guys understand how to boost our immune system and stay healthy through COVID. I've had type 1 for 40 years, so I walk in your shoes every day, and I know this COVID world is just a whole nother level of stress. And so I am here sharing education and inspiration to all of us living with type 1 for how we can stay sane and healthy through these interesting times. So let's see, where's my decks? How am I doing today? Well, I am high. For all of you that think I never go high, I'm going to turn up my brightness so you can see. I ate a half a sandwich, about 20 grams of carb, about 45 minutes ago, and I forgot to dose. So I am going to go on a bike ride as soon as I finish this, but I am high today, 147. So I know that most of you think this is not high, but if you've been following me for a while, you know that to me, and hopefully someday to you, this will be high. My goal is 70 to 120 most of the time, 70 to 140. For those of you in millimole, just divide that by 18 to get your number. But as you can see, I had a nice flat line for a long time. Let's see, I'm going to go back throughout the night here. Yeah, well, it's pretty flat until right now. Let's see, I'm trying to get this. The screen doesn't always obey my touching commands, but anyway, so there we go for the past 24 hours or so, and I just didn't dose for my lunch because I was thinking I was going to dose right before I went on my bike ride, but I haven't gone on my bike ride yet. So I just dosed. I'm talking to you guys, and then I'm going to go on my bike ride. So I'll be back down to hopefully below 100 pretty soon. But one thing that causes a low, there's only one. Do you know what it is? All my patients that I work with, they know. I've been doing virtual practice now for almost 10 years. I help patients just like you with type 1. I have online courses. I am here as a resource to help all of us with type 1. And so this answer is really essential for you to know. Injected insulin is the only thing for those of us with type 1 that causes a low. Now, yes, of course, I know there's people out there with hypoglycemia, but I'm not going to cover that. I'm talking about you and I who inject insulin every day. The main number one thing that causes a low is injected insulin, okay? People think that exercise causes a low, and I'm here to say exercise only indirectly causes a low. You've got to have enough insulin in your body for the exercise to work on to make you go low. Because think about it, 99% of the other people out there, when they go exercise, they don't go low, right? What's the difference? They're not injecting insulin. So the big aha moment that I'm offering here is that when you become a master at understanding how and when to properly dose your insulin, you will dramatically reduce your lows. Okay, I spent my whole childhood stuffing my face with food to avoid lows because that's what I was told to do. And now I've learned that we don't have to do that. And you don't have to stay high when you're driving if you're scared of a low when you're driving, like a patient of mine said when she first met me a while ago. You don't have to stay high the whole time you're exercising because you're afraid of low. What you need is to know how to better understand when your insulin peaks, when it's out of your system, is your basal set right? Is your long-acting set right? So now I am going to go on my bike ride. I'm not going to double down crash. I'll probably hopefully just kind of cruise right back down to 80. And, I'll happily do a quick Facebook Live if I have time when I get back from my ride to show you. So I want you to really understand that when you know how to properly dose your insulin, you will dramatically reduce your lows, okay? If you want to learn more, I have a whole course that covers this. Well, two actually. One that's called How to Get Off the Blood Sugar Roller Coaster. Well, actually, 3 courses. I have one on exercise and blood sugar and one on mealtime dosing. So I'm passionate about helping you get your A1C below 6.5, okay? Because every time we go high, we do damage to the body. Like right now, there's little tiny microinflammation happening. Now, we can't freak out every time we're high or else we'll just drive ourselves crazy, right? I mean, I've had type 1 for 40 years, so I'm sure I went 200, 300 on a regular basis back in the 1980s. But luckily, with great tools like the Dex or whatever if you're on the Libre, and our rapid insulins, we have such better tools now. So unfortunately, most of us haven't received the education we need to really get dialed in and have normal blood sugar levels. But I promise you, if you follow my courses, if you want to work with me, you will get maybe the best education you've ever received. That is what patients that find me tell me all the time. So if you want to learn more about my resources so you can get really good blood sugar care and not keep feeling like diabetes is driving you crazy, just check out my website. It's drjodynd.com. It's DRJODYND.com. N is in naturopathic, D is in doctor. Lisa says, hi, I love your stories. Thanks, Lisa. I'm glad that you like my stories. I like telling my stories. It was so fun. Yesterday, I talked to 100 of Dexcom's technical support people in the Philippines, which was awesome. I shared with them my whole story of, what it's really like to live with type 1, because if they're on tech support, they only hear it from us, when we're frustrated and the sensor failed or something's not working. So Dexcom wanted to make sure their tech support team actually knows what it's really like to live with type 1. So that was special. I loved sharing my story with them. And I love sharing my story with you guys. So if you like this video, please let me know. I love hearing from you, even if this is, not live anymore. Just leave a comment below. And I will be doing these now just 2 days a week, Mondays and Wednesdays, right around 3 o'clock Pacific, 6 o'clock Eastern. After finishing 100 Facebook Lives that I was doing every day, Monday through Friday since March, I'm now going to be working on creating a membership program. It's a monthly membership program where we'll have live Q&As and interviews and training and community. My goal is to help as many type 1s as I can. So I want you to really understand today's point, that when you understand how to not have too much insulin in your body at any one time, like when you're sleeping or when you're exercising, you can greatly reduce your lows. I'm not worried at all about having double down arrows on my bike ride right now because I barely have any insulin in me. I just took a tiny bit of insulin for my lunch, so I know it's not too much to make me crash. And when you master that, it's life-changing. So thanks for watching today's video. Please keep following me. Sign up for any of my free offers on my website, so I've got your email so you can be notified of when I have new offers coming. I'm working on them. I'm a one-man show right now, so I'm looking to hire some technical support people to help me with all of the online aspect of my job. And I will continue to do private calls with all of you wonderful patients who work with me. And so please, there's great free resources on my website for you, drjodynd.com. So have a great rest of your week. I'll see you next Monday, 3 o'clock. And please leave a comment below. I love hearing from you. Have a great day. Here's to healthy blood sugar levels. Bye for now.